So welcome. Thank you to those of you who have joined us today. We appreciate your time. We know schedules are busy. So we're going to jump right into it. And I wanted to welcome you to the National Center for Adoption Competent Mental Health Services, our introduction to this new initiative funded by the Children's Bureau. And I have the pleasure of introducing Dr. Randy Walters. Let me get my slide to advance from the Children's Bureau, and she has a welcome message for you.
Good afternoon, everyone. I'm Randy Walters, and I'm currently the Division Director at the Capacity Building Division at the Children's Bureau. And we have both the privilege and the responsibility of trying to think about how we can fund what is most needed by you in the field. I'm pretty fresh back to federal government from serving in an urban child welfare agency as the director. And I felt like what woke me up, aside from, well, fatalities were what I spent a ton of time thinking about. But after that, it was probably the kids that were in our care that were experiencing psychiatric hospital overstays or sleeping in our offices because we just did not have the kind of service array that we needed most often to meet their mental health needs. And so that sense of urgency, I do feel that my colleague June Dorn and I have been just thinking about what could we do in terms of a national center that would meet those kind of needs, the intersection of mental health and child welfare. When I was a director, I absolutely understood that I could not solve the problems of accessing the services that my kids needed without the mental health agency right at the table. I also knew that they couldn't solve some of their most pressing issues in serving the same kids without our collaboration and partnership. So what we want to tell you about today is a new funding opportunity that creates a national center that is meant to really serve you, not in writing agendas or talking about implementation science, though there can be a time for that, but really to get into your jurisdictions and help with systems change, to be the experts, to be the eyes and ears on the ground, to move your systems forward. We expect this to be active in terms of what is being brought to you. So that's what we want to tell you about today. What is available to you free of charge, a service that we believe will make you at the cutting edge, able to tell your governor, this is what we're doing to address the mental health crisis. And this is what we're doing to make sure we're addressing the workforce crisis. So I couldn't be more excited to provide that opportunity. I'm happy to talk with any of you at any time about how I might have used this kind of service in Baltimore City, but I will turn things over, Debbie, to you to just talk a little bit more about this exciting opportunity for you.
Thanks, Dr. Walters. I appreciate that. Welcome, everybody. I'm Debbie Riley, and I'm really pleased to meet you all. I'm the CEO here at CASE, who has the honor of leading this initiative, and I'll introduce my distinguished colleague.
Hi, I'm Mary Wachanski, and I'm the director for the National Center for Adoption Competent Mental Health Services. And I know our time is short today, so we're going to bring to you just the highlights of the National Center and how we believe we can be of service to you. So, Erin, did you want to introduce yourself?
Yes, hello. I think I was corresponding maybe with a few of you. My name is Erin Bader, and I'm the Director of Knowledge and Dissemination for the National Center. And I'll just say you are free from the obligation of taking notes. We'll share the PowerPoint presentation afterwards so that you can have this information to share at your office. And we will keep on going.
So I think just to ground us a little bit more from what Dr. Walters was sharing, I think we all know that there's an extreme need, that we have a population of children that access and need mental health services. I think the data reflects that about 80% of children in care have some mental health need and mental health diagnosis. We right now are faced with a lot of acuity and complex cases. families and youth themselves are articulating that they have a hard time finding the right provider that understands the issues. And the accessibility aspect is very much a barrier. And we don't want to see the overutilization of ERs and hospitalizations and residential care as a way to meet the mental health needs of children. And in this particular initiative, even though we're terming it, the National Center for Adoption Competent Mental Health Services, we're really embracing children and families who have touched the system throughout the continuum, anywhere in the continuum of care. And then we have to be still cognizant of the stigma that's attached to identifying the need and then reaching out for help. And so also, as Dr. Walters said, on the flip side, we've got workforce capacity issues. We have a strained system that's really trying to enhance professional development and the kind of training, the competencies that are aligned with the needs of this population. And most importantly, this initiative really wants to focus on cross-system collaboration of bringing the two key systems of child welfare and behavioral health together to address the need. So that sort of is the foundational construct, I think, of this initiative. Next slide. And this further substantiates, what we're looking at as far as why we're here today to talk about these issues. And I'm sure you're all cognizant of what it is. I know what strikes me the most is that when we're not addressing this effectively, we're looking at lifelong disorders. So 60% of youth in care have lifelong mental health challenges. And I do believe that this initiative will help mitigate some of those unfortunate outcomes. Next slide. So the National Center was, really created to focus on building the collaboration between child welfare and mental health and increasing the accessibility of what we're calling adoption competent mental health services by building the competency of both the child welfare and the mental health workforce. And many of you listening today may be familiar with our first initiative funded by the Children's Bureau, NTI, and we've learned an awful lot over the past 9 years from this initiative. The success of it is that the curriculum is embedded in 33 state child welfare systems and in mental health systems across the country, not as depth that we would have liked to on the mental health side. And we're really cognizant of the need to further build the workforce through the infusion of this curriculum, but also in building collaboratives, learning collaboratives and coaching, because we know that we have sort of a green workforce now with a lot of experienced clinicians exiting during COVID. And so we have a lot of onboarding to do from a competency standpoint. So I hope you can see that this is way beyond just adoption and the impact that it can have in your systems of care. So I'm going to turn it over to Mary.
Okay, great. So as we started, we're very excited about the National Center. I think the key points here are really that we are driving the provision of mental health services that meet the needs of the population and that are culturally and linguistically appropriate for families. And so we are going to be doing that by first creating a national center with deep expertise. And what that means is that we are creating both knowledge, materials, and technical assistance provision in our center. We're going to be facilitating active engagement, and I'll share a little bit as we move forward about how that's already happening with our knowledge and with the services that we're providing. Most importantly, as we talk about changing practice, I want to focus on that. Debbie talked about, training and mental health adoption competency. Why are we doing that? We're doing that to change the way that people deliver their practice so that outcomes can be changed. And so when we deliver intensive tailored on-site technical assistance, we really are going to be, talking with each jurisdiction to find out what is their most pressing need and designing a plan to address that need. Next slide. We're talking real fast to get through this in the time we've allotted. So we have 5 key outcomes. And the number one is increasing collaboration, because we know that the challenges that we have right now cannot be solved by any system alone. And so we need the collaboration of mental health, child welfare, family voice, lived experience, and we also can bring to the table other child serving systems because there are so many children who are crossover children who are served in multiple systems. And if we can reduce duplication of effort, it's going to be a huge win for that jurisdiction. We're going to also look at increasing the use of the training that Debbie talked about, the online national training initiative. And then looking at service accessibility, because training a workforce is terrific and we desperately need to do that. But we also need to remember it's only as good as the accessibility of those services. And so we need to look at each jurisdiction around what are the barriers to access. Sometimes it's geographic, sometimes it's fiscal, sometimes it's service deserts, but we'll work with jurisdictions to identify what those barriers are and come up with innovative solutions to help create more accessibility. Sustainability is always at the center of our work in the beginning and through the end. We want to make sure that we are building systems that last beyond the time that we're there on the ground, so that the system that invests in this initiative can continue to have great outcomes over time. And again, we're doing all of this work for one reason. We really believe that when we improve the mental health outcomes of children and families, we will achieve improved well-being, stability, permanency. And I want to say we often talk about children as kind of the subject, but we really have a family focus here. Families need the mental health services as well. Okay, next slide. So we have partnered with a group of wonderful organizations to bring specific expertise. I'm not going to read the organizations, but I just want to say that we are very thoughtful and strategic about what competencies do we need to bring to our technical assistants, both in terms of developing materials and best practices, but also in delivering technical assistance. So we have deep expertise in the provision of adoption competence, in the delivery of mental health training, in practices around youth engagement and family engagement, as well as policy, research, and so forth. So again, very strategic. All of these folks, depending on the technical assistance plan, would be available to you if you choose to do technical assistance with the center. Okay, next slide. I wanted to share this because we have kicked off in Oklahoma. We had a wonderful kickoff meeting last Thursday, and I think it's always great to hear what other people believe about the center so far. So sharing this, and I won't read it to you, but what really resonated for me was looking at this as an opportunity to create pathways to hope. And so if we're able to do that for families and for systems and for providers, all of whom are overwhelmed, all these concentric circles who work in this space, if we can do that, we will have achieved a lot. And Dr. Deborah Shropshire in Oklahoma, the director of the Health and Human Services Department, was kind enough to give us this quote. She fully is engaged with us and is willing to talk with anyone who is interested in pushing this forward. So we wanted to share that with you. Okay, next slide. Okay, so real quick, what are the benefits if you choose to work with the National Center, which I hope you will certainly consider? We bring to you at no cost to you the online training of NTI. And that's an incredible, I know a lot of states are familiar, but we're trying to broaden and deepen the providers who have taken that training in every state. But it's not just about taking a training. We're also going to bring to you an ability to have coaching, which actually shifts practice. In the mental health space particularly, we know that training alone doesn't translate outside of the training room, but we need coaching, supervision, and structure to embed the training over time. And so that's what we'll bring to you, along with our on-site tailored technical assistance, as we spoke about. We've talked a little bit about what we hope to see long-term around collaboration, workforce competencies, access to therapists, enhanced family involvement. But I think the last two bullets are important to talk about, the alignment of our service with your system priorities. So as a technical assistance site, we are listening to the jurisdiction about what their priorities are, what goals they're driving, and we are aligning our supports and services to help support that work, not to create additional burden, but actually to help you in the lift of those goals at your jurisdiction. And then again, access to this national multidisciplinary team of experts who knows what's working well in various states, that they can bring that information to you. Okay, next slide.
I know that we're at time, but I think we just have do we want to quickly go through the last few slides, Mary?
I think we have 2 slides left, right?
Okay, I think so, yeah.
Okay.
So I can cover this one real quick. So our technical assistance kind of falls into 2 categories. The universal technical assistance, which is available to everyone. We have a knowledge hub on our website that will continue to grow in resources related to topics, pretty much any topic related to mental health, child welfare, and adoption competence. So you can see a diverse group of resources, and we will be connecting professionals to peer-to-peer learning opportunities. And then we have our intensive technical assistance, which we've already kind of started to address, to build cross-system collaboration in states, tribes, and territories. We'll bring that expertise that we've mentioned and make sure to integrate and help you all integrate youth and family voice. And let me.
Okay, I'm not going to go into technical assistance because I'm going to invite all of you who are on the call to give us a call, and I can walk through it with you at a deeper level. And so you can really understand what our model of the National Center is. So I'll skip to the very last slide in terms of just summarizing what I hope you'll take away from this. Again, our technical assistance is designed to meet your needs and tailored for your goals and your barriers specific to your jurisdiction. It is a cross-system focus. Again, the importance here is that we need both child welfare and mental health systems to be working together. The integration of lived experience, again, a focus on a broader equity framework. We know that from the beginning to the end in child welfare and mental health, there is not equity in access or provision or receipt of services, and we need to help support that. We are designed specifically, the focus here is improved mental health services. So if you take that away, again, we're leveraging what you're already doing at no cost to you. And so that's a really key point. And then again, we are providing technical assistance in a combination of virtual and in-person to meet your ability to digest the service. So again, it'll be tailored to your needs. And then a seamless connection to others engaged in the National Center. And as well as, I just wanted to, I know we're talking really quickly to get through. I think we're 2 minutes over. But again, I invite all of you, this is really quick. We want to have a broader, deeper conversation, and we're happy to do that at any time. So go ahead, Erin.
I was just going to say, so thank you all. This was a unique opportunity. We really just wanted to provide an introduction and hope that this leads to further conversations where we can provide more information. You can visit our website, which is there, or if you have specific questions about technical assistance, feel free to reach out to Mary. And then if you scan the QR code under number 3, you can sign up for our email list. We only send a few emails. We will not overwhelm your inbox. So with that, I just want to say thank you very much for making time to join us today. And hopefully we will talk further at a later date.